But this is our field. Our field is all about nuance, right? And
Yeah.
you mentioned here that you tell your patients that you are more than your symptoms, you're more than your symptom cluster, you're more than your diagnosis, right? Do you know how many times I've had to say that in my practice? Like, I say that all the time. And again, it frustrates me because, like, that is the exact opposite of what I'm seeing on social media these days, Allison, about mental health. For today's episode, we're going to talk about social media and its impact on mental health. This is obviously a very large topic. We could talk a lot about this. So just in terms of trying to dial down what I'm about to discuss today, we're going to talk about how has social media impacted how people talk about it. We're going to talk about it in terms of how it's positively impacted the discussion around mental health in the general discourse. And we're also going to talk about some potential downsides of that as well. And I've talked about this in a previous episode, but to be able to talk about it more, I brought on a special guest today, Dr. Allison Jackson, who is a Harvard-trained, board-certified psychiatrist, currently based in Tampa, Florida, and she is committed to providing comprehensive mental health care that is individually tailored. She is very well versed in the art and science of medication management and psychotherapy. And Dr. Jackson, before you do a little bit of talking, I'm going to tell the viewers a little bit more about you because I have you here captive. And so I'm going to talk well about you in front of you. And I also need to get more guests on this show. So I figured if I keep on talking well about these guests, I'm going to be able to get more guests on in the future. So that's my idea around this. So Allison and I, we know each other because we went to the same residency program. Allison was a few years removed from me in terms of starting the program. And there are two things I want to mention to you, Allison, that I want the viewers to know. So Allison, you were the program chief resident, and for the people that don't know what that actually means, my shorthand of explaining it to others is that every year the program decides who the most trustworthy and who the most responsible senior resident is. And for Allison's class, it was her. So if you're ever coming across any sort of medical professional who was a chief resident, you know firsthand that they're usually pretty competent, they're usually pretty trustworthy, and they're usually pretty responsible. Now, what that also entails is that they probably make you do a whole bunch of things that you may not necessarily fully agree with or may want to do. And I'm sure you have lots of stories about that, Allison, but we're not going to get into that. Not today. I will do a natural segue here about the fact that was it you, Allison, that started the residency social media page?
I don't even know how it started, but I know that I ended up taking it on pretty early. I don't remember if I named it or not, but we definitely started it very early. And yeah, I was heading mostly Instagram, but then we also kind of, we're expanding our, involvement in other areas too.
Okay. What was your experience like? How did you find that experience of kind of doing social media as part of the residency program?
I think that it was something that was not super unfamiliar to me because I had kind of been put into these roles in every section of my life. Like in undergrad, I was like the biology president for the biology club, and so I would make all the social media for them, which I really enjoy. Just making people take really funny selfies or just doing capturing all the fun things that we do. And this kind of was a similar situation where we want to kind of show what awesome things the residents are up to and make our program look very personable and show off all of its, unique aspects so that potential residents would like to come see us.
I'll tell you this. I don't know if you were running the social media page when I did this, but I recorded myself doing a 24-hour call in the emergency room at various snapshots in this 24 hours. And one of my concerns, which to the credit of whoever was running, I don't know if it was you or maybe it was a person above your class, they allowed it to run. And the reason why I was a little concerned is it shows some of the less appealing parts of a residency experience, which is a 24-hour call. So was that you when I gave it to you?
So, I mean, I've definitely seen it, and so I feel like that. I don't remember if I was the one that was heading it at that time, but I do recall seeing it, and that I remember being like, this is gold. If you're going to have anyone do it, you have to have Andy do it, because no one's going to be able to sell this because it's call, and call's going to look bad in many ways.
All right.
Especially 24-hour call.
Yeah, so good times in residency. But all right, so before we get into this actual topic of social media, Allison, is there anything you want to share to the viewers about yourself or about your practice?
Well, I'm based in Tampa, Florida, and I see folks all around the state of Florida. It's a big state, and there's not a ton of psychiatrists. And so I just really enjoy working with a wide range of different folks. But one of the areas that I probably see the most kind of patient population is college students. And so I have become quite well versed in social media and how that interacts with mental health, because college students, they definitely have lives that can in some ways be very much centered around social media, as well as dating apps and all of that, and all the mental health kind of aspects. Whereas prior to that, as someone who is a millennial who grew up with this kind of becoming a thing, we had like Tumblr and AIM and MySpace and Neopets and all that good stuff that, it was a little bit different back then. It was still a big thing. Like, it was still something that was a big part of our lives, but it has been really interesting for me to see kind of how social media has changed over time. And yeah, that's been something that's been a surprisingly big part of my practice.
I guess if we first talk about the first area of discussion, I think it's worth acknowledging the definitely positive aspects of social media. And I've talked about this before, but really, I think universally speaking, the best positive aspect of social media is that of de-stigmatizing or reducing the stigma around talking about having a mental health issue, about seeking help for a mental health issue, and connection and belonging. So Allison, you have mentioned a little bit about this sense of connection and belonging in the usage of social media, but can you say more about that?
Yeah, so I think that when social media was first kind of starting up, like, this was in some ways maybe the premise that they were looking for in general, is like, if we're going to have this kind of social setting on the internet where people from all over the world can kind of find their niche and find like who is like them, or explore is this an identity thing for me? Is this something that I feel passionate about? Maybe it's this like very small corner of the internet where we're all into this one specific tiny little thing, and finding people that are like you and being able to kind of grow those bonds. And I think that is something that's really powerful, and that's something that can be quite beautiful. And seeing there's some fun documentaries out there kind of about that, and seeing even gaming on the internet and things, and like how close bonds like this can be like true friendships. This is not like an imaginary person, but yeah, there's a lot of interesting aspects, I think, to the connection and belonging piece, and why that is something that can be really unique. Because in the real life, especially, I'm someone that came from a very rural state. I came from Arkansas. I grew up in like the middle of nowhere, where there's more cows than people, less than 1,000 people in the town. If you want to like meet someone that has similar interests as you, that's not like, raising cows, that you may have to go to the internet. And so I definitely can vibe with the idea that the internet can be a place that can be really useful for connection and belonging, especially if you're, kind of isolated from that standpoint.
You also mentioned something about the internet in terms of helping explore identity. What do you mean by that? I can kind of imagine what you're getting at there, but say more about that, Allison.
Yeah, I mean, I think that the internet has all these interesting little corners, and so kind of exploring like, I think that social media in many ways like is often does market to these younger people that are in this stage of life where they are figuring out who they are. And the internet can provide these spaces where they can look at what this looks like. They can see, okay, these people look like they're having a whole lot of fun and they're really into, playing Dungeons and Dragons. Or, this corner of the internet is really enjoying gardening this one very rare breed of plant. And that, okay, we can all be passionate about this. That kind of figuring out, what are things that I'm passionate about and how does that kind of relate to who I am and who I want to be. I think it opens up a really kind of more like a bigger world in general than, some people that grow up in the middle of nowhere with cows surrounding them. That can feel like a good place to maybe, open up your eyes a little bit and see what's around you.
And you touched upon this just earlier now, but there is a bit of a generational difference in terms of how people use social media and how people perceive social media. So I think, Allison, you and I were millennials, so we grew up with social media sort of in its infancy days. And the younger generation, how they experience social media is pretty much completely different than how we view it, and also how even maybe the baby boomer generation also views it, having grown up without any sort of social media. And at least when it comes to clinical practice, you mentioned seeing a lot of college-age students or younger students. I do actually think that, just putting it out there, right? Like, I don't think social media is totally bad. It's not a universally bad thing.
Yeah.
And all of these things that you mentioned are really great and really helpful and can actually help foster better mental health. And I think, as a potential patient wanting to see a clinician, I think they want to be able to talk to a clinician, a therapist, a psychiatrist who has maybe not necessarily a fully sort of biased, like the internet is all bad, you got to shut that down. Because I think realistically speaking, Allison, I don't know if you've actually made this recommendation to any patients, but that's nearly impossible to do.
Oh, yeah. Yeah, it's hard. I did have to learn, though, a lot about how can we, maybe turn down specific aspects, like when it's becoming a little more toxic, it's becoming something that is kind of all-consuming, worsening your anxiety, whatever it may be, that having some awareness of, what are some ways to kind of help make this not as huge of a focus in your life, or at least like make it have a little bit more boundaries on how you're using it, I think has been interesting too. But it has. I agree that social media has been, changing throughout the years, and what we used it for as millennials versus what Gen Z uses it for can be quite different. And just like the style of it, that everything about it can be I think the goals of what the people that are producing it have now versus what it was back then is a little different. I think the kind of identity exploration might have been in some ways a little more of a thing back when it was first starting out, and think now it's definitely evolved in a way where everything is so visual. Everything is just so algorithm based, where you're just kind of looking at, what are these pieces that are the very best parts of this person? How can I edit myself, curate myself to be, the very best kind of person that everyone's going to see from this like surface level. And I think it kind of cuts out some of the unique creativity pieces and kind of actively getting to know people on a more emotional level. Instagram, like, you can't really, get to know people on an emotional level that well through Instagram. Like, I'm scrolling, I'm seeing a curated caption, where nowadays curated captions are a big part of that. Like, you want like something that's like short and snappy. It can't be too long. It can't like give too much. It has to be kind of catchy. That and then this image is an image often that is, whatever was your very best photo that you had, that's maybe edited to look a certain way, that it's not the same kind of level of human interaction that maybe the internet had earlier on.
And just to, I guess, millennial splain for the younger generation, right? Allison, you mentioned the older social media, the MySpaces, the blog sites. I think it's a LiveJournal. I don't know. Did you have a LiveJournal, Allison?
I did not have a live journal, but I had like a Tumblr.
Oh, you had a Tumblr. Okay.
Yeah.
Could you
Yeah.
write stuff in Tumblr? I thought it was pictures, but
Yeah,
you could write stuff in
So
Tumblr
no,
too?
you can write. Oh, you can write stuff in Tumblr. LiveJournal, yes, it's got similar vibes, but yes, you can write things, and there is a yeah, there can be all kinds of unique, almost journal-like of your life that people would post, which
Yeah.
can be
Yeah,
a really
yeah.
like, don't look back into that. That would be lots of people's embarrassing millennial moments.
Well, and you've mentioned, you wrote into the outline, so interaction on the older social media it was slower, it was more deliberate. You had to actually take the time and write somewhat like long form content for people to actually get to know you, and then reciprocally, you are also expected to write similar stuff about yourself too. So it wasn't necessarily as, I guess, asymmetric as it is now, where the user of social media is pretty passive now, and you're just getting bombarded with people that are creating content. And I don't know what the statistics out there are, but the amount of people that are actually generating content versus actually just consuming it, I think is a pretty big proportion, disproportion now versus how it was, back when we were, kind of making our live journals and Zangas and stuff like that.
Absolutely. I think I can just probably even look at my own Instagram of how often I was posting for like myself and my friends versus now how many people I'm following that are, is this just an influencer kind of ad? Like, am I just kind of scrolling through a bunch of ads at this point? Sometimes it feels like that.
And speaking about influencers and content made by, people. So I guess if we go into some of, I guess, the mental health professionals' concerns about social media. We talked about the positives, and maybe if we talk about some of the concerns in terms of social media kind of necessitating this kind of anxiety about oneself, wanting to kind of glamify yourself, make yourself look better, just kind of this, you mentioned like, who am I versus how am I being perceived? Can you say more about this? This sounds very profound.
Yeah, I think that is something that over the years we continue to see more and more of. And it's not just in social media. I think that it's something that in just general feels like it's becoming, a bigger focus. And the level of kind of social anxiety surrounding this that I see has been a lot. That this is something that in a way I think like breeds social anxiety, that, you're constantly thinking about, does this ankle look good? Is my ring light in the right position? Does this sound smart enough? Are they going to think my caption means this? I want to get this point across. And like, which emojis should I use that would, make me feel fun and make me look like a certain way? That this kind of harsh inner critic that people with social anxiety often already have, you add on a whole nother layer where there is this kind of harsh critic that the internet has on you, and then your own inner critic that you have kind of based surrounding that of like, how many likes did I get? How many like reshares? Like, is this something that is my own value? Like, does how many likes I get, does that equate to, that I am not as cool, I'm less attractive, I'm not as successful, that these other people, they must be, prettier, smarter, more successful than me because they, have all of these followers. And I think that can be a kind of dangerous aspect to social media, that can also be in some ways kind of addicting, that you're trying to get these goals, you're trying to reach this level, and that we're also sometimes not really considering that this is highly curated, that these people in some ways do this as a job, like influencers, that is their career in some ways, where they are putting forward this thing. They have help, they have people that are taking these photos or helping them edit them, they're having people help them write these things, and we're comparing ourselves to them. And yeah, it can end up with a lot of struggles with how am I being perceived, which can sometimes translate to, outside of social media into the real world.
I often talk about this with my patients as like the comparison trap, where someone who has the social anxiety, the low sense of self, ends up, having that inner voice, you call it the harsh inner critic, that just kind of says like, you're not good enough, everybody else around you is doing better than you are. And that thought and that belief just gets reinforced when you're on social media, because as you mentioned, there's always somebody prettier than you with a better camera angle, with a more sort of visually appealing whatever have you, that you can find on social media. And really choosing how to engage and not engage with it, I think is helpful in terms of healthy boundaries. But then the other implication here too is for the younger generation, the people that are kids and teenagers. If they don't have the ability to kind of regulate their use now, what is the implication of that further down the line when, necessarily those kids are still trying to develop a healthy sense of themselves. They're trying to actually tune up and tune down like what the appropriate critic is. And I'm curious about your work with these younger college students, if this has ever come up in terms of social media impacting their sense of self.
Oh, absolutely. I feel like that it's a thing that so many of them struggle with, is this balance that pretty much everyone is on social media, pretty much everyone is on the dating apps. And, how do you balance that of, if I kind of separate myself from this and try to kind of, develop my sense of self out of that, yet everyone is, you're getting this kind of sense of like fear of missing out, the college kids and their FOMO of, am I, missing out on what everyone else is doing? And I can't see, where all the cool things are, what everyone's up to. And people will be referencing it and I won't be in the loop. And there's this pull to, stay in it, even when sometimes they begin to pick up on that, hey, like this is making me not feel very good about myself. This is leading to a lot of issues with perfectionism and anxiety and just low self-esteem. And when I take a step back and I feel maybe a little bit better about myself, when I'm kind of looking at the real world and looking at the people around me, and that doesn't translate to what you're seeing on social media, because it's just social media is giving you this tiny little snapshot of someone's picture of themselves, that you are getting someone's legit like highlight reel of their lives. You can't compare yourself to that. You can't compare yourself to someone's like number one shot out of, a million moments in the day. But yes, there's still, even with like them being able to recognize that it does have an impact on how they see themselves and how it makes them feel, there's still this like pull of that everyone is doing it. And if I don't, then I'm going to miss out in some way.
And I think just kind of summarizing what I've told my patients is, you have to be able to recognize, your own social media use, whether or not it is reaching problematic usages, whether or not you are noticing your own sort of anxiety levels rise, your own, self-doubt rise, or your self-confidence rise. And then the other, which is a lot easier said than done, is, being able to sit with that uncertainty, sit with that uncomfortable sort of FOMO feeling. And this is the hardest part that I always tell my patients, if you are able to spend more time in the real world forming connections with people IRL in real life, you will notice your anxiety and your mental health just kind of get better. But that oftentimes is the hardest thing to actually get, my patients to do, and for anyone to actually do. That's the execution part that's difficult.
Yeah, absolutely. It is. It's something that I think everyone is needing to kind of work on that balance and figuring out what that is for them and how they can, kind of find themselves in the real world. And yeah, it is a challenging thing when our entire lives, everything around you is kind of pointing like, look at this, that there are a lot of reminders, but realizing, hey, like that if this is causing me issues, this is leading to worsened, anxiety and self-image, that, hey, maybe there are ways that I can turn this down a little bit and give myself a little more time IRL.
We're going to move on to another potential concern of social media. I am particularly, I guess, passionate / frustrated about this particular phenomena. Allison, I don't know how you feel about this. So this has to do with concept creep. Basically, everyone on social media says that they have ADHD, or they have trauma, or they have depression, or they have anxiety. What the heck is going on, Allison? Why are people saying that they all have ADHD?
So I have like a love-hate kind of relationship with this, because on one side, I absolutely love that there are normalizing mental health and that there are all these ways where, people are seeing these different disorders that have been around for a really long time, but have kind of been, pushed into the shadows, where people are kind of see it as this one thing, and that, a lot of people were being missed. I think like ADHD, for example, there were a lot of women or girls, like when they were growing up, they misdiagnosed. They weren't seen as what is the kind of stereotypical kind of, more loud kind of ADHD that we see in like young boys. That there, I think, are a lot more women that kind of learn about it by hearing all these things on social media and seeing like, hey, that could be maybe what I'm experiencing. So I think there are positives. However, on that, kind of opposite end of that, there's sometimes some misinformation that can lead to people kind of pathologizing what could be, a single symptom that can actually be a lot more broadly applied to a lot of different diagnoses, or also just normal human experience. And that this can sometimes lead to people kind of identifying with a diagnosis, and I can get it, I can validate this struggle, I can understand, like, okay, they're trying to kind of figure out, like, why am I doing the things that I do? And there are people out there that definitely will kind of, continue to kind of feed into that, and that without kind of clarifying, what is this actually? And is this something that could be very much like a normal human experience, a healthy human experience, versus is this a symptom of something else? Is this ADHD? Is this depression? Is this anxiety? Is this perfectionism? Is this literal just burnout because the amount of, wild things going on in the world, the amount of work you're doing, that you're trying to like meet yourself to this bar that's unobtainable, and so of course you're not able to focus because you have like 1,000 things on your plate, that no human can do that. That I think, we have to be aware that not everything that is out on social media is going to be accurate, and that social media is not your therapist, social media is not your psychiatrist, social media is not your doctor. That, there is a lot of misinformation out there, and each unique person has, their own unique symptoms and brain, and so that needs some time to actually like dive into that.
Allison, on the note of like the social media is not your therapist or your psychiatrist, have you seen these shorts, these either TikToks or Instagram shorts, where it's like, they'll put in a couple of things that are highly relatable, common occurrences in life. Like, if you forget where you put your keys were, and, show up 15 minutes late to like hanging out with your friends, and you forgot about a meeting at work, then you have ADHD. And it's like, have you seen these posts? Have you seen these videos?
Oh yeah, I see that, and I can get what they're going for, because I mean, in a marketing standpoint, that's actually pretty smart, because if you are very broad and you pick out some things that, yes, people with ADHD could definitely do those things. Also, everyone else on the planet could also do those things. You could get a lot of likes. You could get a lot of people being like, that's me. And they click the like buttons. That, yeah, I mean, it's a smart marketing strategy. But when it comes to actual diagnoses and how it can kind of put these thoughts in people's head of that, oh, like, is this what I'm experiencing? Is what I'm experiencing actually an illness? Is what I'm doing actually something that needs to be fixed in a way with medications or something that, you know, this is something that can turn out, I think, in a not so helpful way.
Now, you wrote in the outline about this that in reality, things are more nuanced than, you know, whatever it is that we see on social media about diagnoses and mental health conditions. And again, I think this is a function of how social media works. You mentioned wanting to get likes, but also these shorter and shorter video formats where you're supposed to discuss a mental health concept in a really appealing way that'll get likes. So there's no possible way, or at least in my opinion, it's a lot harder to try to put in nuance, but that's like, I don't know, you know, maybe preaching to the choir, because you too are a psychiatrist who sees people in your practice, but this is our field. Our field is all about nuance, right? And,
Yeah.
you know, you mentioned here that you tell your patients that you are more than your symptoms, you're more than your symptom cluster, you're more than your diagnosis, right? Do you know how many times I've had to say that in my practice? Like, I say that all the time. And again, it frustrates me because, like, you know, that is the exact opposite of what I'm seeing on social media these days, Allison, about mental health.
Absolutely. I think that it is something that it can become like a focus where there are accounts that only thing they talk about is this one diagnosis, and they go into all these little tiny possibilities of where, you know, if you run across one video, it's going to have just like what you're describing of like, oh, you forgot your keys, therefore equals, you know, this diagnosis, when in reality, yes, it's much more complex than that. And if you have something that becomes like, this is what defines you, this is, you know, who I am, and that your identity becomes kind of surrounding that, and it can sometimes lead to some struggles, I think, with, you know, how do I kind of balance this with my identity of myself? Does this become something that I'm constantly trying to fix myself rather than, you know, kind of just better understand myself and have some acceptance of that I actually am, you know, in many ways a healthy person, versus also, I think, being able to, you know, seek out some assistance and some help to be able to build maybe some things that can actually help with those, like some strategies that could help with these things. Because sometimes there's also this, okay, well, I must have this, and therefore it is what it is. And there becomes a kind of, okay, this is just how things are. And I think that it's also useful to have some awareness that maybe I should get some more information. Maybe I should talk to a professional. Maybe I should explore this, and that, you know, this could be something that I legitimately have, and that is something that may need these treatments, versus, you know, are these things something that could be explored in therapy? Or also, is this something that's a normal human experience, and that I don't need to pathologize every corner of my life? Because humans are unique, brains are unique. And I think that we need to be able to, you know, feel that that is something that can be a big positive, and that we don't need to try to fix every quirk to someone. Because that is something that's special about human beings, that we're not all copies, we're not all AI, we're not going to be, you know, this kind of, you know, perfection factory. I think that it's, you know, useful to be able to see all the nuance of human beings.
Yes, and you said this, you know, your symptoms are valid and can be they're valid, they're real, it can be a legitimate struggle, and the diagnosis can be a tool to help expand your life, increase your access to treatment options, increase your agency, and to be able to communicate that in the current existing social media.
Oh, yeah.
It's a challenge. It's a challenge.
It is. It is.
One thing I'll also point out too is, obviously there are these like specific condition channels that this is all they do. They post, memes related to a specific condition. They post, videos related to this specific condition. And again, I want to acknowledge that there is some validation that exists for the people out there who do have these conditions, do struggle with them, and are viewing them, and do find, again, the positives of social media, right? They find a sense of belonging. They find a sense of relatability to be able to say, oh yeah, that's true. Like, I feel good because, there is this person out there who is at least trying to get a single snapshot or a sense of who I am, and I feel good about that. Nothing wrong with that. I agree.
Yeah.
There's nothing wrong with that.
Yeah.
It's great, positive, and also, the potential downside is, a bunch of these other people who may not actually have, consulted with a mental health professional or have, been diagnosed with any of these conditions will see this and will end up potentially pathologizing parts of their normal human experience.
Yeah, absolutely. I agree. I think that there are some really, interesting things out there. I do love to see a mental health meme. I mean, I think there are some really fun memes out there you can see that are validating and they are funny and they do kind of shine a little bit of brightness in some areas that can sometimes feel like really dark places for people. So they're positives, but there's also some things that we have to be aware of that are maybe some of the downsides. And so, yeah, I agree. It's nuanced.
All right. The second concept that I want to bring up for discussion today, which I too am also very passionate about, is you mentioned misinformation, but also just kind of generally speaking, there are a ton of mental health scams, people offering treatments, people offering supplements for all sorts of mental health conditions that are really not vetted by a mental health professional or medical professional. That may or may not actually be dangerous, and yet it's everywhere on social media. And this is, I guess I'm curious, Allison. Why do you think this is? Why do you think there's so much mental health scams on social media?
I mean, I think that it can definitely be a moneymaker for people, and it's in some ways it is something that mental health and mental health struggles is something that's so widespread that so many people experience that if you're going to target someone, I could definitely see why some of these influencers or wellness gurus may go after that. Because they have a large population they're trying to target. But it has some really scary outcomes of that. They'll promise things that are, this is the one thing that's going to cure your anxiety, and it's going to be something like you need to, I've heard some things about like, you need to eat this liver, you need to eat this like entire cow's liver, or you need to do this liver detox, or you need to, drink some raw milk, that these things are going to somehow translate to improved mental health, and that it's natural. Therefore, since it's natural, it must be, safe and healthy. In Florida, we have like Tampa specifically, we have an unusual amount of kava and kratom out there too, which are things that are definitely marketed a lot as this kind of natural, healthy thing to like calm your brain and stuff. But they don't really talk about all the potential scary downsides to these things, which, just because something is legal and something is, considered maybe a supplement or something that's natural that comes from a plant. There are a lot of medications that started out from a plant and they can kill you. So yeah, it is. It's a complex misinformation kind of circle that happens on social media where people are always trying to find the best new thing, the magic pill, and it can lead to a lot of people, kind of falling into that trap. Because of course, when you're feeling really down or really stressed, it would be wonderful if we did have something that, okay, this is going to fix things and it's not going to give me any downsides.
Yeah. And if I think about sort of the business or marketing aspect of it, I think, you've identified that everybody wants better mental health, right? Everybody has experienced mental health struggles. And so you already have a great group of people that are like, oh, of course I want to be. Who doesn't want to be happier? Who doesn't want to have more energy? Who doesn't want to sleep better? And so you have a population where people are already interested in getting better. And then if you end up proposing something, this is my hot take why doctors aren't really that popular on social media, is that like it's been ingrained in us, at least in my belief as a doctor, is that I actually have to talk about the potential downsides and the uncertainties of the outcomes of the interventions that I prescribe and the interventions that I use. But also, that doesn't make for a good reel. I can't be taking up the time talking about the risks of medications and the potential fact that you might not actually get the intended outcome. But if I just talk about how great something is and how awesome it's going to make you feel without actually talking about the downsides, that actually makes for a really nice reel.
Yeah, it does. And when it's not a professional that's not being monitored by like, okay, if you say these things and you don't give the downsides, then, for us, like you can get in a lot of trouble. You could lose your license, you can be sued, versus if you're not really part of, a medical organization, or if you're kind of on the outskirts of that, you may not have the same repercussions. And so it's okay to slap this is amazing, this does everything, this is going to have zero downsides for you, even though a lot of times I think they do know there are downsides, there are risks here, but that doesn't sell. And there's not a ton of downsides for them. They're not really going to get the same level of like losing their license or sued as maybe someone in the medical field would be.
And again, right, I find myself getting in very bizarre conversations with some of my patients being like, that's right, this coffee colonic is not going to treat your depression, right? To be able to actually say, very calmly and very obviously, it's the facts, right? And, I wish I didn't have to do that, Allison. I wish I didn't have to have these conversations.
Yeah, it is. It can be scary because I end up with a lot of people that are coming to my clinic after the fact after they have been sold this thing. They've spent a lot of money on it, like a lot of money, like, sometimes a good amount of their life savings on some magical treatment. And then it doesn't play out so well. They end up with some really bad outcomes, and they're still left with these mental health struggles that weren't really addressed. And now they have these other maybe medical concerns on top of it because they're having to bite back from, something that was sold to them as this, natural, healthy, amazing, magical cure. And kind of working through that has been, really hard to see because you really, you get it. You can get like why these people see this and kind of fall into that trap because, you're scrolling on social media and you see that and you're like, is this something that I just don't know about? Is like this something that in medicine we weren't taught this? Like, did we not get enough of this training? And then you're like, okay, I'm going to look into this. I'm going to like see, maybe there's something about this. And then you're reading up on it. You're like, uh-oh, like they like didn't include any of the downsides of this. Like this could kill you. This has got, can cause liver failure. This can, make your heart like have these like terrible long-term issues. And yeah, it's kind of sold as this is something that, is safe. This is something that is the best option for you, that doctors don't talk about this because doctors only like want to be in big pharma's pocket. When in reality, like that's not the case. We are honestly just as frustrated with big pharma as everyone else, and dealing with all the kind of outcomes to that is challenging.
Yeah. Now, one other thing you mentioned, are the lawmakers doing anything about this? Allison, you mentioned Florida's HB3 Act. Can you say more about this act?
Yeah. So Florida, I believe it came in 2025 is like when the law actually kind of started to take effect, and it's the Online Protections for Minors Act. And it's something that it sounds on paper to be something that could be, really useful, in that it bans basically children that are 13 or younger, so children that's brains are still very much developing. They're developing this sense of self, that they can't create new social media accounts, or if you're like 14 or 15, you have to get parental consent. And there's a lot of positives that could come out of that. Like at first glance, that sounds like a great idea. Like these are children that could be very susceptible to all the dangers of social media. And is there a way to make this safer? Like, is this something that, we could maybe delay kind of where people are getting some of this information until their brains are a little bit more developed and they have a better sense of self, where some of those like aspects of like bullying and predatory kind of content, like some of the really, really scary stuff, can we kind of maybe limit that? So on one part, yes, there are some positives here. However, there's also these pieces that, when you kind of look closer at it, that are potentially some cons here of how this might play out, such as like how well this kind of works. First of all, like these are targeting this age group that these children often got really good digital literacy, some ways better than their parents. And so is them kind of needing to be secret about this and try to circumvent, get around these rules, is that going to lead to the idea that social media needs to be this secretive process and that I need to hide this? I can't tell my parents about this because this is, bad, bad, bad. This is something I need to sneak around about. So there's that piece. I think also just the idea that, this may affect some people more than others, because even if, say, you are of age to start getting this, you have to have like your age verification of how are they going to do that. Is that going to be something that you require like an ID for these children, that could potentially affect lower income youth, that, this could also push some of the different adolescents onto websites that are more like unregulated, kind of private things that are under the radar. Because Florida, when they wrote this law, while they were kind of in some ways like vaguely referencing some of the really big websites, like commonly known, like Facebook and Instagram, all that kind of stuff, they kind of left it open-ended of like anything that's kind of social media aspects, so that they could include those things. However, how much they keep track of this and how well it translates to how they do that, the internet expands so quickly. Like it's near impossible for it to keep up with all of these kind of underground places where, kids are kind of impressive with how they're able to find those things. So there's some aspects there that I think we really have to consider of, there's pros and cons here. I haven't seen it translate as much because I don't work with people under the age of 18, so I haven't seen as much of outcomes, but I am really curious when I'm talking with my colleagues of like, what are you seeing here? Has this been something that's been helpful now, or is this something that it just is not really translating to reality because there's just way too many ways around it?
So I guess like knowing that there's all these not so great things about social media, and Allison, I'm having you on my podcast that I'm promoting on a social media platform. How do you conceptualize using social media as a professional mental health clinician?
Yeah. I do use social media. I'm someone that finds that there has to be a balance, and figuring out what that balance is for yourself, I think, is really important, and having some awareness of when things are becoming, too much of a focus for you, and things like doom scrolling and things, and how also the pieces of my own kind of personal social media use versus like my use of this in a setting of being a psychiatrist, and how I interact, and like having my business profile of how what kind of information I put out there, and how that can be something that can be helpful for people, but also wanting to, show them some reality of a situation where, we can't give all of this information like out there. It can't be something where I'm going to teach this one topic in one Instagram post, because that it's just not going to happen. Like, this is something that is a lot more nuanced, is a lot more detailed, and one little caption is not really going to give you the full picture of someone's diagnosis or all the nuance of the kind of medication options or the therapy options for certain things. But I think that it still is something that can be a useful tool. It just has to have some level of awareness that this is not the only thing. This is just one little piece of the puzzle, and it can't be the end all be all. The social media is not your therapist, is not your doctor, and having some knowledge about that, I think, is really useful.
Well said, Allison. And I guess just personally for me, because I'm starting this social media professionally, I think it's just trying to, there's a part of me that feels like I'm kind of leaning into all things bad related to social media, right? This podcast, ideally, people would actually listen to an entire podcast just in the audio form. But here I am having to come up with a video recording, having to come up with video shorts that I'm going to have to clip, and having to come up with captions, just so that people actually click on this, so they're actually even aware of the potential downsides of social media. So in a way, I feel like I'm trying to incept people into having a healthier view on mental health with the stuff that I'm creating right now. So we'll see if it works, Allison.
Yep, I'll be interested to watch, Andy. I think it is a good thing to give a try.
All right. Anything else for the viewers to listen and to hear about on your end, Allison?
I think that we covered the big stuff. I think just having overarching idea that, hey, there are pros and cons to social media, and that there are some things to look into, that if you're having struggles with this is becoming something that in some ways is an addiction, that there are ways to help with that, and that this is something that a lot of people struggle with. You're not alone. You're not a crazy person. You're not someone that, this is not something that's totally out of the norm. A lot of people are struggling with this, and there's, interestingly, a lot of different ways to combat that and to help with reducing, your exposures in a way that can be really healthy for your life. And so we're not saying that social media is a total no-go. We're not saying you need to unplug your computer and live in the forest or something. We're not saying that, but there is ways that, maybe turning down some of this input and allowing your brain to be IRL a little bit longer can be beneficial.
Okay, great. Well said, Allison. Thank you for being on this podcast, and maybe I will see you in a future one.
Sounds good, Andy. Thanks for having me.